Hello and welcome to today's video on jaundice in children. I am your dietitian Annie, and I am here to talk about the importance of nutrition and diet in the prevention and management of jaundice in children. Jaundice is a common condition in children, which can be caused by various factors such as infection, liver disease, or metabolic disorders. But did you know that the right nutrition and diet can play a critical role in managing jaundice in children? In this video, we will discuss the causes, symptoms, and management of jaundice in children, and how nutrition and diet can help in the prevention and management of this condition. Causes and symptoms of jaundice. Firstly, let's understand the causes and symptoms of jaundice in children. Jaundice is caused by the buildup of bilirubin, a yellow pigment produced when red blood cells break down. In newborns, jaundice is often a normal and temporary condition, but in some cases, it can be a sign of an underlying condition. Symptoms of jaundice include yellowing of the skin and eyes, dark urine, pale stools, and fatigue. Let's talk about nutrition plan for jaundice in children. So, what role does nutrition and diet play in the prevention and management of jaundice in children? A healthy and balanced diet can help prevent jaundice by promoting liver health and reducing the risk of infection. In the case of jaundice, a specific diet plan is recommended, which includes foods that are easy to digest and promote liver health. Here are some dietary recommendations that can help in the prevention and management of jaundice. First, breastfeeding. Breastfeeding is recommended for infants with jaundice as it promotes healthy liver function and helps in the elimination of bilirubin. Breast milk also contains nutrients that promote overall health and immunity. Second is adequate hydration. Adequate hydration is crucial in preventing and managing jaundice. It helps in flushing out toxins from the body and promoting liver health. Encourage your child to drink plenty of fluids like water, clear broths, and herbal teas. Third one is high carbohydrate diet. A high carbohydrate diet is recommended as it provides energy to the body and helps in the metabolism of bilirubin. Foods like rice, potatoes, pasta, and bread are good sources of carbohydrates. Fourth one is low-fat diet. A low-fat diet is recommended as it reduces the workload on the liver and promotes healthy liver function. Foods like lean meats, fish, fruits, and vegetables are good sources of low-fat nutrition. At last, we recommend avoiding certain foods like fried foods, fatty meats, and processed foods can help prevent the buildup of toxins in the body and promote liver health. In short, jaundice is a common condition in children that can be prevented and managed through a healthy and balanced diet. A diet plan that is high in carbohydrates, low in fat, and rich in nutrients can help promote liver health and reduce the risk of infection. Breastfeeding, hydration, and avoiding certain foods can also play a critical role in preventing and managing jaundice in children. As a clinical nutritionist, I recommend consulting a healthcare professional before making any dietary changes, especially if your child has an underlying medical condition. Let's discuss a general diet plan for jaundice. As a clinical nutritionist, I would recommend the following one-day nutrition plan for a child with jaundice. In breakfast, I recommend 1 cup of cooked oatmeal made with milk and honey, 1 sliced banana, 1 glass of freshly squeezed orange juice. In mid-morning snack, 1 small apple, 1 tablespoon of peanut butter, 1 glass of water. In lunch, 1 cup of chicken and vegetable soup, made with halal chicken and fresh vegetables such as carrots, potatoes, and spinach. 1 slice of whole wheat bread. 1 cup of cucumber and tomato salad with a drizzle of olive oil and lemon juice. 1 glass of water. For evening snack, 1 small bowl of sliced fruits, such as watermelon, grapes, and mangoes. 1 glass of water. In dinner, 1 cup of brown rice. 1 small serving of grilled fish, such as halibut or salmon. 1 cup of steamed mixed vegetables, such as broccoli, cauliflower, and carrots. 1 glass of water. Notes: it's important to avoid fried and fatty foods as they can worsen jaundice. Fluids are essential to flush out toxins, so it's important to stay hydrated throughout the day. Encourage the child to eat small, frequent meals throughout the day rather than large meals to help ease digestion. This plan is just an example, and it's important to consult with a healthcare provider or registered dietitian to create a customized nutrition plan based on the child's specific needs and medical history. Thank you for watching today's video on jaundice in children and nutrition guidelines. If you have any questions or comments, please leave them in the comment section below, and don't forget to subscribe to our channel for more informative videos on nutrition and health.